ultrasound scan of a 55-year-old female, first in supine posture, with you can see a scar in you can see a scar line. This scar line is that of cholecystectomy that she had about a year back, and below this we see very hard immobile mass. It extends from this region up to here, subchondral region to hypogastric region. Now this is a very hard mass with irregular borders. So let's see what is the pathology below it. And this patient has been referred to evaluate for this mass just below the incision, cholecystectomy incision, and so we start with the ultrasound. Well, first of all, this is the I will go from the center, evaluate the liver first. This is the left lobe of the liver in longitudinal section, this area. This is the aorta. This is the portal vein. This is the portal vein at the region of the porta hepatis, and this is the kidney. Now towards the right lobe, both poles are clear, and the right kidney is normal. The liver shows relatively post-exit and shows early cirrhotic changes. As you can see that this area diffuse increased parenchymal echogenicity post-exit, and the outer surface of the liver does not show significant irregularity. So early, these are the early liver parenchymal changes of that of the liver. Now, let's come to the mass, area of the mass. Now, at the hypochondrial region, we do see now there is a mass, but just below, in the region of the hypochondrium, just 3.5 millimeters from the skin, below the skin, in the region of the right hypochondrium, it's a hypoechoic mass, solid, as we do not see significant amount of posterior wall acoustic enhancement, and you can see that this mass is extending into the anteriorly up to the skin, just 3.5 millimeters below the skin, whereas the mass. So this is the extension of the mass, and this mass is 10.3 millimeters from the skin in the region of the right hypochondrium, with these being the extensions. These are the extensions of the mass below the skin in the subcutaneous tissue, and this is the peritoneal line. This white line indicates the peritoneal line. So this is This is in the subcutaneous tissue below the skin. And now when I move the probe bit posteriorly, I see another mass, this one. This is the second one. Now you see that this mass is also approximately 6.3 millimeters below the skin, and the region just below the right hypochondrium, posterior to the initial mass, measuring approximately 5.74 into 3.34 centimeters. So this is the second one, and it is seen in this region with patient in supine posture. Here, in this location. You see, this is the location from where I am getting this this mass. Now the initial mass was here. This is the first one, and then here is the extension, a second extension of the mass. So this is the area where the mass lies. Now let's see the mass. Let's study the mass. Now the mass has outer border which is relatively irregular. Its internal echogenicity is that of mixed echo, a bit few cystic areas, tiny small cystic areas can be seen within it, and there is a calcification also. There is a calcification within it. Now you see, now these are the two masses together communicating with each other, and if you just see that with the respiration, this area moves. This is the intraperitoneal region. Okay, now this is the peritoneal line. This line is the peritoneal line, and you can see movement in this area with respiration. There is no movement in the masses. They communicate with each other. They communicate with each other in this location. This is the intraperitoneal region where you can see bowel gases, etc. This is the peritoneal line. This line is that of the peritoneum. So extraperitoneal masses with internal calcification in subcutaneous region. Communicating with each other in this region. So these are the two masses. And here this is the communicating point between the two subcutaneous collection. Here is the communication between these two mixed echo, relatively solid masses which are in the subcutaneous tissue. And the both are One is approximately 4.2 millimeters below the skin, and the second is 4.2 millimeters below the skin, and the second is 8.9 millimeters below the skin. Now the appearance of these masses is that of either an abscess, now let's see the pancreas. Here we see pancreas. This is the pancreas. In transverse section, this is the splenic vein, superior mesenteric vein, aorta, superior mesenteric artery, and if you see that here the liver appears to have irregularity of its wall, and the liver is seen below costal margin. The liver is enlarged. This is the aorta. This is the superior mesenteric artery, celiac axis. This is the bowel segment, left lobe of the liver in longitudinal section. Now, this is the left lobe of the liver, the ligamentum venosum, the IVC, and the choroid lobe of the liver. So, the masses that we see do not relate to the pancreas and or to the kidney, as we saw, and not to the muscle, not to the liver as well. This is the total view of the liver. This is the transverse section, longitudinal section of the liver. Both lobes can be seen. This is the transverse section. There is no pleural effusion, as this is the diaphragm, right hemidiaphragm, no fluid seen. So, and here comes this is the mass. So this mass is not relating to the liver, to the pancreas, or to the kidney. Gallbladder has been removed surgically. It is not in the not relating to the retroperitoneal region. Rather, it is in the subcutaneous tissues and from the just below the skin. It extends posteriorly up to the it extends posteriorly and medially. This is the lateral one, and this is the medial one. And they are communicating with each other just below the skin. This is the peritoneal line, and this is the extraperitoneal masses, and having internal calcifications, most probably consistent with collection of infective nature until unless proven otherwise. A second finding in this patient is that has to be evaluated is that I did saw some dilation of the intrahepatic bile ducts. Here you see. She gives history of fever with rigors, and here you see that this is the portal vein. This is the hepatic artery transverse section. This is the common bile duct, and it is filled with ecogenic material of different strength and with tiny ecogenic area as well. So, and the common bile duct measures 12.9 millimeters. Normal, it should not exceed 9 millimeters with removed gallbladder. So this common bile duct is dilated and is filled with sludge. This is sludge within the common bile duct. The portal vein is of normal caliber, early stage cirrhotic liver. This is the portal vein and it's patent. So there is very early stage mild intrahepatic bile duct ectasia. And this finding, keeping in view the history of the patient having fever with rigors, is with the common bile duct filled with sludge, is consistent with cholangitis. However, the possibility of a tumor sludge cannot be ruled out by ultrasound. This is the common bile duct, this area, and it is filled with ecogenic material. The sludge, this is the portal vein. And here is the head of the pancreas. This is the head of the pancreas. It has no relation with the pancreas at all. Pancreas is absolutely normal. And this is the finding which indicates that this is sludge in the dilated common bile duct. Again, this is the clear lumen within of the common bile duct. Here the common bile duct is dilated and is filled with thick ecogenic material. This is the hepatic artery in transverse section. This is the portal vein, and this is the IVC in transverse section. This is the liver, early stage cirrhotic liver, the part of the diaphragm. And the CBD can be traced to its most distal end, and even at this stage area, this is the portal vein and this is the common bile duct. It can be traced up to the inferior border of the head of the pancreas, which is this one. This is the head of the pancreas in longitudinal section. This area. This is the head of the pancreas in longitudinal section. This is the common bile duct, the most distal. And we know that the CBD courses the posterior inferior surface of the head of the pancreas. And this is the portal vein. So in this patient we see two pathologies. One, two subcutaneous collection in the subcutaneous collections in the region of the hypochondrium extending posteriorly, consistent with abscesses, or simply, if you wish, it would be better to say that collections with dense coarse ecogenic material within it, and the dilated common bile duct measuring approximately 11.1 millimeters without gallbladder, whereas normal measurement should not exceed more than 9 millimeters without gallbladder, as we know that the gallbladder has been removed in this case. And this is the second pathology, which is suggestive of cholangitis, which is suggestive of cholangitis. Caudate lobe is normal. There is no adenopathy seen in the region of the porta hepatis. This is the region of the porta hepatis. Liver is mildly cirrhotic. Early cirrhotic changes are seen in the liver. If I come down, these echogenic areas that we were seeing just below the subcostal region do not cross the midline, do not relate to any other organ. There is no pleural effusion, there is no para-aortic flank lymphadenopathy. The spleen is normal in dimension 10.5. The kidney is normal. See that these are the subcutaneous corrections. See that they do not move with the intraperitoneal. This is the intraperitoneal region. They do not move with the respiration. They are fixed in their location. This is the urinary bladder. This is the postmenopausal uterus. This area. There is no ascites seen. This is the aorta. This is the IVC. This is the inferior vena cava. So, two subcutaneous region masses with internal calcification and dilated CBD filled with sludge and minimal intrahepatic, very early stage bilateral tissue. Thank you.